Assalamu alaikum. Today we are discussing dealing with a large stone of the urinary bladder. It was a young patient who is diabetic and hypertensive. The diabetes was managed by the oral medications, and he is 54 years old gentleman who presented with severe lower urinary tract symptoms for the past 1 to 1.5 years. And there was a severe dysuria, severe pain at the maturation, and there was on and off reddish discoloration of the urine as well. Upon investigations, his prostate was around 45 to 50 grams with a median lobe, but he had a large stone of 4.2 centimeter, and on the X-ray pelvis, the stone was a rounded stone and a large stone. So we counseled him about the procedure that we will go and do Cystourethroscopy, and then we will decide whether to go for Cystolitholapexy or a percutaneous cystolithotomy, or even an open vesicolithotomy. So when we performed the Cystourethroscopy, it turned out that there was a occluding prostate to high degree with a median lobe as well as the lateral lobes, and the bladder was mild to moderately trabeculated, and the stone was extremely rounded, and there was no way that the stone punch could catch it. So instead of going for a percutaneous Cystolitholapexy or cystolithotripsy or even open vesicolithotomy, we plan to fragment the stone into pieces, 4 or 5 pieces of such structure that then the stone punch can grab it. So here you can see that we are drawing a line and dividing the stone into 2 pieces by using the laser fiber. One line has been drawn, and now we are drawing another line across, one this line and the other one in this direction, and then we will rotate the stone and expose the opposite surface, the contralateral surface of the stone, so that we can draw a line into that as well. Completely converting the stone into sand by laser fiber will take a long time. So I think this was the one good way in order to avoid vesicolithotomy, in order to avoid percutaneous cystolithotomy, and also not take a very long time. Even this fragmentation with the laser, it took us around 45 to 50 minutes. And then the rest of the procedure with the stone punch, which means litholapexy, it took around 10 minutes. And all of the stone was removed and cleared of the urinary bladder. As we all know that if the stone is very small, then the procedure for the obstructing prostate can be performed at the same time in the form of transurethral dissection. However, if the stone is very large and it takes a lot of time, like for example 40 to 50 minutes or 60 minutes or even more, then if you perform a transurethral resection of the prostate, that can lead to a higher incidence of infection, urinary tract infections and infection of the raw surface. So it's better to perform these 2 procedures in 2 settings. So that is the standard, but in this case the patient was of a younger age and sexually active as well, and wanted to preserve his sexual function as well. That's why we counseled him, and upon his agreement we came to the agreement that we will perform his litholapexy and removal of the stone, and then he will be on alpha blockers for a while, and then if he feels or we feel that the prostate is still occluding, he has got a large post void, or if he goes into retention again, then we may perform transurethral resection. So the chances of post-operative infection will be really small. So here you can see that the stone has been fragmented into 2 or 3 large pieces by the laser fiber. And after that, we are performing the litholapexy by stone punch. And so the rest of the procedure becomes a routine procedure. As you can see, the important thing before going for litholapexy or during litholapexy is that there should be minimum of bleed, because if it starts bleeding, the mucosa gets injured, or if there is a median lobe and by manipulation of the cystoscope or the stone punch, the mucosa gets injured and it starts bleeding, there is a highly likely chance that the procedure may not be completed safely, and at times you can leave small fragments because of the clot or the bleed, so because they are not visible. So here you can see that the vision is quite clear. We perform the fragmentation of the stone in a good manner, not to cause any bleed. And now you can see that the stone punch can very easily grab all the pieces, and those can be removed. However, even in this case, there was a little bit of mucosal injury on the posterior wall near the dome because of the stone punch. However, the stone is completely fragmented, and then it is completely removed. The small pieces are then removed by ilex evacuator, and after that we placed a 3-week catheter and started normal saline irrigation for 4 to 6 hours, and the patient stayed overnight with us, and next day when the catheter was clear, the irrigation was stopped and the patient was sent home, and he was also started on alpha blocker with the combination therapy of tamsulosin and dutasteride, and the catheter was removed on 3rd day, and we will be following him up after 4 weeks with a Qmax uroflowmetry and a post void. Thank you very much. Enjoy the procedure.